City. So this is going to be a special episode. It's our first episode for the year. We're celebrating a different kind of awareness for this month. Usually, diba, we know that February is Valentine's season, it's a heart month. But worldwide, we're also celebrating low vision awareness. So we're so lucky to be joined today by one of our ophthalmologists who is practicing in low vision. And it's no other than Dr. Jelynne Marfori, or we all know her as Dr. Jen. So welcome to Health Hour, Dr. Jen.
Thank you, Claude. I just like to wish you a Happy New Year
Happy New Year to Dr.
Medical City South Luzon and to the TMC South Luzon Health Hour.
Let's start our discussion, Doc, with what is low vision?
Yes, so what is low vision? Low vision refers to any functional loss or functional impairment of vision of a person that cannot be fully addressed by regular glasses, contact lenses, your usual surgeries and treatments, but they still have a functional vision that they use. We have a wide range of ophthalmologic diseases that could lead to low vision. But the more common that we see in the clinics are those having moderate or advanced stages of certain diseases, such as age-related macular degeneration. So these are the diseases of our elderly, those who have risk factors, may mga heart diseases and hypertension, those who smoke for a longest period of time, and of course we're in a tropical country, we're exposed in the harsh UV, ultraviolet rays. So those who have advanced glaucoma, it can be acquired or inherited. Not only their visual acuity, but the field of vision, yung kabuuan ng vision that I failed to mention earlier, na it's not just acuity, but the field of vision. So halimbawa, a patient regularly see 150 degrees, ang lawak ng paningin. But people with glaucoma constricts to smaller, less than 20 degrees.
Parang ganun lang yun, Doc. Like, ganyan lang.
Ganyan lang.
Yeah.
And then, others like diabetic, those with diabetic retinopathies, you hear them undergoing lasers, injections or surgeries. So, their visual acuity is affected as well. Although last na most common siguro yung congenital hereditary night blindness. Yeah, so those with parang meron, it runs in the family, in the paternal side, their grandfather, great-great-grandfather. And then their vision is really decreased, most especially at night, na parang they become blind. But there is still some very useful vision.
Okay, so in terms of treatment, Doctora, do we treat low vision separately? Aside from their current eye condition, let's say if they have glaucoma, do they undergo a different treatment?
Correct. So, as mentioned a while ago, these are our patients with their primary ophthalmologist na at work, So, in low vision kasi can be considered as a team of doctors, That you have your main ophthalmologist, you have your optometrist to really give you the best spectacle correction. However, with certain tasks, we need certain aids or help, which brings us to the next, what are their options?
Yes, so what are their options to actually still be functional even with low vision?
Exactly.
Yeah. Are there options for them that's available?
Yeah, correct. Low vision often comes, medyo depressed because they have low vision, or parang people are treating them as nearing blind, But we tell them, you're not blind. You still have that vision and we'll hold on to it.
Okay.
Alright, so siguro we'll just break it down to 3 categories yung ating approach to treatment. We have the optical aids, we have the non-optical, and we touch on the occupational therapy. So this is yung mga how they can go about with their mobility and in their everyday lives. So parang there. So tatlo yan sila.
Just to clarify, like if you already have low vision, parang you're just going to maximize that amount or that certain degree of vision that you have left, right? It's not like just
maximize
to
and enhance further.
But maybe just to meet expectations. Kasi sometimes siguro, some patients will expect na from let's say 20% or something, when they get treatment or when they see a doctor, their vision is going to be 100%. How do you explain or
Approach
manage?
that.
Yes,
Yes, correct. Kasi first and foremost, when the patient comes in, we ask them, did your doctor already talk to you about your disease?
Yeah.
Do you fully know and understand where your disease is leading you to? So, ganun. So, first acceptance talaga on the part of the patient is very important because that's where we gauge the success of the treatment options that we'll offer them. So, for mga near jobs, given they're wearing their corrected spectacles nga or contact lenses. So, for near work, yung mga for spot, no, yung mga reading your medicines or some labels and stuff. So, we have your mga handheld magnifiers, no? So, this is used for a certain distance, no? And so, we measure it, so we compute it for you.
Okay.
So, depends on how you want things or letters magnified. So, this is ano lang. So, hand magnifiers. You also have your lighted stand magnifiers.
Wow.
Also for near. So, it has light, no? With it. So, this one naman for near and for longer viewing. So, if you want to like read pages or books, so medyo mahaba sila. So, you just put it on top of it and it will magnify for you. So, you just move it left to right and then down left to right again. Also, your mga bright field magnifier that you put in the prints. That's for the near. And for the more intermediate or far, we have mga telescopic devices, which is this. So, this is a mono telescope. So, they can use it for in mga intermediate or for far, for recognizing faces, for knowing their place, their surroundings. It's also a safety that every low vision patient has this in their pockets, no? For quick reference. Also, for ano naman, for distances binocular, so especially with if they have binocular vision left naman, left and right, medyo good pa. These are some more common optical.
Pwede pa silang manood ng concert.
Yes.
Talaga gano'n na lang. Diba? So, since we have so many options naman pala for people with low vision, how would a patient know, Doc? Or what do they expect in a consultation?
Oh, yes, correct. Nice question, Ma'am Claude. So, unlike your regular ophthalmology consult, we try to instruct them before they come to us. Okay, bring your existing eyewear. Your glasses, their glasses, contacts and shades, and then bring your working materials, or parang let's mimic your workstation.
So they have to bring also, like, do they bring laptops?
Yes, if they use it, we let them bring it, no, and then we sit together and we instruct them. So how near do you want to work? How big do you want things to appear, or how wide do you want them covered by your vision aid? So we do some measurements, no, and some trial and error in fitting the most common mga low vision aids. Also, we do in the clinics contrast sensitivity testing and glare testing. Kasi that is also important, because if that's addressed, acuity can better.
So it's not like the end of the world na yun.
Oh my gosh, yeah,
diba?
no.
Parang I'm so depressed na I'm just gonna feel like this, na wala na akong chance makakita ng big, wider and nice things in life. It doesn't end there, right?
Yes.
So what is your last or message to them about low vision and how to address it and how do we deal with it?
Yes. First, thank you, Claudine, for having me here. And also, we welcome you to the Medical City South Luzon, Department of Ophthalmology. We have, your complement of ophthalmologists there.
Right.
Mondays to Saturdays, 8 to 5, including holidays.
Yes.
So, we have
no
it
days
there.
off.
Yeah, it's talaga. And then those with low vision patients, if your doctor tells you that, okay, your best vision is just 20/70 or worse, or you have a visual field of less than 20, no, don't fret. You have a wide range of options for you. Just come visit us, and we'll show you how, and you will tell us how we can help you more on your daily activities.
Yes.
So,
Our eye center and our department of ophthalmologists are here to help you. Thanks again. Thank you once more, Dr. Je, for your time here and to talk more about low vision. And since it's low vision awareness, so we hope that we were able to give you knowledge and how do we take it in our daily lives. So thank you and bye everyone. See you in the next episode.